Approximately 1 in 50 Americans are estimated to have fibromyalgia, according to the American College of Rheumatology. That's 2 to 4% of the population. The disease predominantly affects women, but it's generally not well understood. So joining us to explain more is Dr. Donna Kamour, author of Women's Health for Life. Thanks so much for joining us,
My
Dr.
pleasure.
Kamour. So why don't we start by what is fibromyalgia? Because I think it affects such a large number of people and yet is so little understood.
It's little understood by the medical community as well as by people at large, and so this is very important. But very simplistically, fibromyalgia is a common, chronic, complex pain syndrome. And we call it a syndrome because it's not a specific disease that we can identify the cause of and say this is what is the underlying scientific basis for, but it has a lot of symptoms that go along with the pain. So it's not just pain, it's pain associated with tender points throughout the body, or what we say is in all 4 quadrants of the body. It's associated with severe fatigue, which can be very disabling in and of itself, as well as cognitive symptoms, so cognitive dysfunction, impaired memory, decreased focus, decreased concentration. Patients call this fibro fog. You know, they get in kind of this disoriented state sometimes. But it's also accompanied by chest pain, abdominal pain. Patients can become depressed either as a result of the illness or because of other independent factors.
It's hard to imagine living every day and feeling pain in so many different ways. You know, a lot of times this is a disease that's thought of and associated with middle-aged women, but that's not the case.
No, it's most common in middle-aged women and overwhelmingly more common in women than men, which is why it's very often put aside and they get patted on the head and said, oh, this is all in your head. Well, it may be in their heads because of altered brain chemistry, but the pain and the other symptoms are throughout the whole bodies. But what I found fascinating about this is 1 in 6 people with fibromyalgia are actually under the age of 18.
Wow.
And then we also see a tremendous increase in older Americans over age 80. But men can get this as well.
Is it difficult to treat?
It's very difficult to diagnose. The good news is there are 3 FDA-approved medical treatments, but this is not the kind of disease where you can just take a pill and you're cured. This is where you need multiple modalities, which involves multiple doctors. And of course, that's very difficult for people who are very often on disability or not on disability because they have trouble getting disability because of the poorly understood nature of this condition. So their incomes are suffering, their relationships are suffering, their mobility is decreased, and yet they're trying to get to all these different doctors and physical therapists and acupuncturists and massage therapists to get the complete therapy that they need.
So it's so hard to imagine having to deal with all of those difficulties at once. And you actually say that that has led to an increase in suicide.
Well, it's not me saying it. A study that was presented at the American College of Rheumatology meeting in November, a big study that actually looked at over 8,000 patients and followed them for over 35 years, was specifically designed to look at the increased risk of death in fibromyalgia patients, and found that the risk of suicide was more than 3 times greater in women with fibromyalgia than women who don't have fibromyalgia. The other thing was the increased risk of fatal accidents. So of course we always worry about car crashes, and that makes sense if you have fibro fog and you're not focused and concentrating, or your reaction time is decreased, you might be at increased risk for car crashes. But of course we also have to factor in the effects of medications that people may be taking. As I said, there are 3 prescription FDA-approved medications, but there are many medications that are used what we call off-label, where they're not specifically approved for this, and every medication has side effects. Of course, patients are also taking over-the-counter medicines to help them with their pain, but also with sleep. And disrupted sleep and unrefreshed sleep is a huge problem that can also contribute to accidents.
So these are all sort of comorbid conditions
Exactly.
with fibromyalgia. It's not just about pain. It's about that it affects your psyche, it affects your sleep.
Well, when we talk about, those are symptoms. When we talk about comorbid conditions, we're talking about other diseases, disorders, or syndromes that go along with fibromyalgia. And that may include temporomandibular joint syndrome, severe PMS, multiple chemical sensitivities, costochondritis, and something called myofascial pain syndrome, as well as many other disorders.
Such a long list. So the first thing is to get diagnosed, though.
Absolutely.
And that's the hard part.
And it may mean that you have to go to multiple different physicians. Of course, I want physicians to become better educated on this as well. The American College of Rheumatology also came out with new diagnostic criteria this past year in order to make it more simple for primary care physicians to make the diagnosis. So first of all, I want all primary care physicians to read those guidelines.
Right.
But next, patients may need to see a rheumatologist as well to get the proper diagnosis and care that they need.
Okay, some really important information. Dr. Donna Moore, thanks so much.
Thank you, Stephanie.
And for more information on this topic and others, log on to the health page at abcnews.com for the latest health news.